Our roundtable today is titled Language Access Across Care Journey from First Words to Lasting Impact. My name is Catherine Adames, currently the Director of Interpreting Services. Also, I'm very proudly a Spanish interpreter, and it is an honor for me to guide this very important conversation. Very passionate about interpreting in any industry, but since I am a medical interpreter, this specific subject is truly important for me. And regardless of where we stand within the role of either a healthcare provider, as an interpreter, language access professional, or just like all of us, professionals in the language access industry, I think it is important for us to hear the experts that will be sharing this subject with us today. And I will allow them to introduce themselves briefly before we go into subject matter. Misty?
Hi, good afternoon. Thank you for having me. I just wanted to quick introduce myself. I'm Misty Bowman. I work for Penn State Health Hershey Medical Center, and I'm the manager of interpreter services of a team of in-house interpreters and then also contracted providers that we contract with outside. My background comes from several years of being here at the medical center, doing patient experience, patient and family centered care, and then also moving into interpreter services. And then I've done 21 plus years with early intervention, going in and out of homes, meeting people, doing a lot of different things with families in their homes. We have about 611 beds here at the hospital in the big medical center. The Children's Hospital is attached to that. We have 146 beds. And then our ambulatory sites are 80 plus clinics. So I oversee interpreter services in all of those areas in placing people into those areas to help provide interpreter services. So I'll stop there, but thank you for having me.
Thank you so much, Misty. Mirabelle?
Hello, everyone. Good morning. It's about over 10 a.m. in the West Coast. I'm in Long Beach, California. I'm a nurse director here at St. Mary Hospital, Long Beach. I oversee 3 service lines: the nurse medical surgical unit, the acute rehab unit, and PT, OT, SC. Those are our therapists. And as you would imagine, I am in close contact with the frontline staff. They're the drivers of it all. I've been a nurse 19, 20 plus years. So, hey, I don't look that old, but I am. It's been a really rewarding profession for me, and language access is huge for me. I'm also of an African background, so you would imagine that is something that I hold close to my heart. It's great to be here. Thanks.
Thank you so much. Liz?
Hi, everyone. I'm Liz. I am the language access expert with Effectiff, and I have a background in deaf education, interpreting, and language access ally. So I'm super excited to be here and to join the conversation.
Thank you so much, ladies. Let's go straight into subject matter. Okay, so when it comes to patient experience, what do you think is the most powerful moment where language access can either make or break the care journey? And how does each of your roles influence this? Very interesting. Mirabelle, you want to take this one?
Sure. This is a great question, right? Connection is everything to me. I always tell my nurses, everyone communicates, but only a few people connect. Connection is everything. So when it comes to language access, that first contact, that first intake is crucial, right? We have designed a system where it's integrated in our network. It's not language is optional. Language is just part of the lingo. It's part of who we are. It's part of humanity. We make sure we have a seamless access to those systems in the ED, in our clinics, or admissions when we get patients admitted. So we have teaching services to our nurses so they have that cultural understanding of different cultures. We have our electronic system. We have champions in place. As much as we have electronics in place to translate, we need the human touch as well. It can be a real video, but we need that human touch. So we have champions that speak bilingual languages, that speak Spanish, what have you. We have a very huge Cambodian community here in Long Beach, California. So we make sure we incorporate that to our community's needs.
Thank you so much, Mirabelle.
Can I just add on to that? Mirabelle,
Yeah.
I love what you said about connection, because that is really the most important thing. And the best way to do that is with trust. So with the training that you guys have in place and the, advocates and the experts that are there to help every step of the way, those patients don't feel like it's an afterthought to have that language access. We talk about, it's not just a checked box, okay? And it sounds like you guys are doing it right over there and making sure that that access is not at the bottom of that list.
Yeah, totally agree.
Love that.
Thank you, ladies. Misty?
Yeah, I really love it also. I think from the very first contact, whether it's on the phone or meeting in person or in the hallway, wherever that contact is, that first experience, no matter what, is like your patient experience make or break. If you don't have a telephone line in your system, you make or break it right there. You can't even communicate with your patients that are calling in. That's a big firm belief of mine. You have to have those things for patients to get to you in the first place. If you don't, there's not that experience, and it just, maybe they'll go somewhere else. It's part of that experience that they need to feel that trust that you're talking about, Liz, and just feel that patient family-centered careness is there, that patient-centeredness, and they all need to be part of that. So that's what I'm feeling pretty strongly about.
Very nicely said, and piggybacking on all of that, a big word for me came from this trust, and I think it goes in hand with also people feeling safe. When you go to a hospital, you already have a worry. You either go to the emergency room, you go because you have a follow-up pre-existing condition, you go because there's something going on and you don't know what's going on. So you already are programmed to worry. So imagine if at the moment that you walk into that hospital, you're not able to communicate. And we've experienced that, or at least I have experienced that firsthand. And sometimes I feel organizations forget that as soon as a patient walks in, clear communication should start. Typically, when a patient walks into a hospital, if they're not familiar with the hospital or clinic, they want to ask someone where they go. So if they cannot ask someone at the front desk or even before that security, then communication breaks right there. They're going to be late maybe to their appointment because they're running a little behind on time. So making sure that as the language access process is established, communication starts at your door. Security, there are services that we're able to provide over the phone. Not necessarily do you need an on-site interpreter for this. So I think managing that communication, like you all said beautifully. And in addition to this, it does help people feel included and taken care of as soon as we're able to provide communication to them. So thank you so much for sharing this, ladies. Okay, so there's a lot of talk about cultural competence, and I can never say this word right, competence in language access. How do each of you incorporate cultural sensitivity and awareness into your language access efforts? And how does this affect patient trust and outcomes? And I know that Mirabelle did mention some coaching or training that she does with her team. So I would like to also hear maybe a little bit more about that.
Yeah, this is the core of it all, right? Because it's not just operations of things in place, it's also personal. And in order for us to make sure we have the right people in front of our people, is to make sure that we assess their biases. We have to, the onboarding process, when we have new hires, new employees into the system, is for us to assess their cultural sensitivity, their biases, their judgments. It's really looking at cultural scripts to give them? Are they culturally attuned? Do they know different backgrounds? That's the baseline, and we take it from there and bring that awareness to them. And signages too is key in the ED or other departments to make sure when our people walk into the building, they feel welcome. They're vulnerable, like you mentioned already. They're really vulnerable. We want to make sure they feel welcome, they feel understood. I always tell my nurses, language can either open a door or build a wall. And we are the bridges. We need to build the bridges. So that's how we look at things. Training our staff, looking at linguistic competency, looking at emotional empathy, and the third is looking at and cultural understanding. And when we have those three in place, and making sure that we have champions in every department in case there is a little break in our system or a little fallout or things are not happening, we have things in place to call, to have a champion to say, I have you, I got you.
Wonderful. Thank you so much. Misty?
Wow, I have, you just said everything. It's amazing what you all are doing there. We do have trainings for our staff. We do rely heavily on those systems and our and employee orientations, really to just hit it while it comes in when you're learning from the door, and really just making sure our right values are there. Those right values apply to everyone. So that respect and integrity, that excellence of just making sure that we are doing the right thing for our patients. We do have people around that are gaining their qualified medical interpreting, that are staff, that we are growing that program more and more so that our folks come in and feel comfortable, and then they're certified and qualified to be able to speak in medical terminology and or just everyday conversation. And those are the things that really are integrated into the system and really make a difference in what we're doing here. And certainly all of the things that we did with our diversity area, has helped us really gain a lot with cultural competency, and just really make, and our interpreters, right? Our interpreters who are in-house for us have really been able to do a lot of teaching with our staff and really answer questions right there about different cultures. We have folks that are from the Dominican Republic and we have people from Chile. And both of those interpreters bring different aspects to our culture and community. And so our staff learn a lot about different things. I learned something the other day about a straw, right? I didn't know that straw meant something different in each of those cultures. And so, the mom didn't understand what a tube was. So they described it as a straw and she got it. And so I learn even from my folks every day. And so I look to those opportunities for our staff to teach, and I look for it to learn. And so that's where I would, what I would share right now about incorporating the sensitivity and emotional and empathetic impact that we would have.
Beautiful.
Absolutely. I love that. Just to back up what Misty just said, as a former ASL interpreter, when you go into the room and the, nurse that is taking care of the patient that you're there to support says, tell him or ask her, it's really important for that interpreter to be able to say, and for the nurse to be able to receive, that actually you should speak directly to your patient. You should say, sir, how are you feeling? Or, ma'am, can I get something for you? Or, when was the last time that you had, water, whatever, being able to understand that communication for the deaf community and the Hispanic community and the French community, there's something different with all of them. And that's part of what's so beautiful about it. But it's something that's really helpful for us to know, and to know that we can trust those providers that are in there helping to facilitate communication.
You girls have said it very nicely. As an interpreter, I can tell you that part of our training, initial training, is teaching us about culture. Misty said something about how interpreters from different nationalities have meanings for, or in every nationality, I know for Spanish speakers, there's different meanings for different things. And we see this all the time when we're interpreting. And as we understand culture, and I think it's so beautiful that in our industry, we're able to speak to so many people from different countries that speak our same language, yet they're not communicating like I was taught to communicate in my native country, for example. And I am able to understand them. And if, as an interpreter, I don't have that cultural understanding, it will be very difficult for me to even approach anyone Spanish speaking to communicate. I think it's important that part of culture that we are taught as interpreters is also making sure that we express every little detail, especially in a medical encounter, that the patient wants to communicate physically, pain, as they're expressing their pain, and sometimes even the tone that they're answering their questions in, because the nurses, the doctors are able to better understand the severity of their situation. Also, and I know that sometimes we may want to step away from the role of, or the main role of interpreting, which is a conduit, just transfer the information that you hear. Sometimes if there is a cultural barrier, we're able to take a step back and say, doctor, there is a cultural situation here and your patient may be having, right now I may not be using the right words to express this because there is a protocol for this, but they may not be understanding what you're saying. And so with our knowledge, we're able to break culture. Actually, the definition of an interpreter always brings be a cultural broker. We're able to break these cultures and we're able to facilitate the communication. Okay, thank you so much, ladies. Moving on. In your experience, what's the most creative strategy you've seen to improve language access that could benefit all healthcare organizations, where in clinical or localization settings? Misty, I'm picking on you right now.
Yeah, that's a tall order. But being in this hospital, I'm privileged to have in-house staff. And I think having in-house staff has made a huge difference and will continue to make a huge difference in providing services to our patients and families. There's a difference to me between having those in-house folks and bringing someone in from the outside. There's a difference between knowing your providers, just a sensitivity that I find with my interpreters in-house that is different from an outsider coming in. Not that they're any worse or better. It just, there's an empathetic feeling, and they're going into the OR and they're going, to have conversations about death and different things like that. And so I see those struggles some days when they come back and they've been in a situation where it's intense. You're in there and you're seeing great things happen and you're seeing, very sad things happen. But I really enjoy having that. They're an amazing group of people. And I think our interpreter rewards program really has brought something different to the table, allowing different people in the hospital to gain their qualified medical interpreter certification. It allows us to have more people in areas in which they work be able to interpret. So for us, I think it's great. I think it's also something could benefit other organizations and clinical or other settings. The more people we get that can speak a different language, the more people we reach on a daily basis.
Yes. Yes. Liz, you want to add anything?
I was just thinking about that too, as far as having the staff that's bilingual and just to join in with that, sometimes it's really helpful for the patients, especially if they're in a scary or traumatic situation, to see someone that they can relate to, someone that they can feel like, okay, you understand me, but also knowing that, your staff interpreter knows the facility, knows the doctors, knows the day-to-day, how everything is run, can be really helpful as well.
Yeah.
Absolutely.
I like that a lot. I think we talk about tools, but then just having that person that you can relate with is really important. Because we're not only translating words, we're translating emotions, we're translating context, we're translating on nonverbal cues, right? And that's what I really try to empower my nurses to, look at. It's all about the eye contact. It's about the touch. It's about your presence. Is sitting close to the patient instead of standing and talking over the patient. All those things are really important. It can either bring anxiety or it can build trust.
Absolutely. Focusing from my experience directing operations for interpretation, I've seen it all, especially during COVID times. It was rough, but the fact that COVID has brought the need, or has enhanced the need, to integrate and to display how virtual interpreting can also be a great way to communicate, and that now more healthcare organizations are open to integrate our softwares to theirs, so that communication is just click click and you're able to connect. I think that has been, for me, one of the breakthroughs of our industry. As a medical interpreter, I can tell you that, and I've been in all fields. I've been on site and I've also been virtual, mostly virtual. But I know that communication for most of the medical encounters virtually works wonders, same as it would be if you had someone on site. I think that there are certain situations, and I know that for mental health, for example, and maybe more sensitive things, mother, child, childbirth, when you're going to share to someone that their patient is in a very critical condition. Yes, on-site interpreting does help. You want that human touch, like you guys mentioned earlier, but virtual interpreting also works wonders. We're able to provide interpreters only over the phone. And I think that's very interesting as well when it comes to privacy. If you have a patient that is going to an OBGYN visit, no one is looking at you. No one is going to look at your face when you're discussing about very private things. And then if you want to see someone for another encounter, then we also have virtual interpreting as well that we're able to provide and integrate to your softwares. We can thank COVID for that.
I was just gonna add on to that. Like, COVID opened everything, kind of gave virtual a chance, made virtual a need. And it really opened the doors as well to those rural communities who struggle to get the interpreters that they need in their area. I mean, having VRI to pull up when you don't have a sign language interpreter within 6 hours is life-changing for that deaf community, especially just because, they would have gone without before, but now, we see that virtual has its place, it has its time, and that it can be very helpful. Like I said, especially in those rural situations where there is no option for somebody to come in.
Yes, there are certain languages, dialects still, that we do not have access to in our nation. And if we do, some of these interpreters are not well trained. And we want to make sure that we're able to provide. We would definitely let the medical professional know and the hospital know that we do not have this language specifically within the country, but we're able to provide you a trained and ready interpreter for this dialect that is offshore, and communication happens very nicely. I want to just add a comment from one of our listeners on LinkedIn, or viewers on LinkedIn. Gilia says, and I'm sorry if I'm saying your name wrong, I absolutely agree. As someone who has been on both sides, needing some kind of care in a foreign language and feeling how intimidating it could be, and also having the opportunity to make the bridge with interpretation, communication in a way to establish connection is essential. And I think she's going back to our previous question. And I want to thank you, Gilia from Brazil, for sharing that with us today. All right, do we want to add anything else before we move on? Nope.
I can add that even federal laws and regulations, and such as Joint Commission and AHRQ, all these organizations now are holding organizations accountable when it comes to language access. And it is part of health disparities and reducing risk. So it's not just us doing the job, but we are held accountable by the government and
Yes.
regulatory bodies.
Absolutely. And part of our work, and I'd like to call myself an advocate for language access. Part of the things that I've done personally is make sure that people know that they have a right to communicate, especially in very sensitive situations, and that they want to make sure that they're provided language access when it comes to the medical field. Thank you,
This is
ladies.
Sorry, just to add on, Catherine, to what you just said, during our last roundtable, there was conversation about, patients maybe feeling like they shouldn't ask for services when they get to the hospital just due to fear. And, one thing we discussed was letting the communities know, reaching out to them in whatever platform, they're most likely to, be on. And letting them know, hey, our hospital is still a safe place. We are still here. We are still providing access. We will not turn you away. We will get you the help that you need and the communication access that you need.
Absolutely. Hello, everyone. Hello, Andrew. And I think I saw Alex there saying hello as well. All right. So, as a team, how do you all handle the training of staff? I know that we have probably discussed this a little bit, but we can go into details now. Whether interpreters, nurses, or language access teams, to ensure they're not just linguistically accurate, but also culturally competent and emotionally empathetic. Beautiful.
Really quick, I just wanted to mention too that this is something that we have talked about at so many roundtables. What does that education look like? What does that training look like? And I know Mirabelle and Misty, you both kind of touched on how important that is. I'm super excited to hear, what that looks like for you guys and how you're, how that is helping with the success that you've seen.
Yeah, so we didn't want to just do it organization-wise. We looked at the system and working for CommonSpirit, we looked at data, right? What are our patients saying? Surveys, feedback, because we can't just create something just because we have to add language. It's not just an addition. It's part of the system. So we receive data. We really targeted patients post-discharge, post-service. Tell us about your experience when it comes to language. And we received that data. After that, we created a tailored approach. We looked at linguistic accuracy. Are we using the right terminology? Is it legally compliant? Are we ensuring the terminology is correct? And then we looked at cultural excellence, right? We want to make sure we shared case studies. There are different taboos in different cultures that are acceptable in different cultures. We looked at reflective exercises. It was really one of those workshops to really help us understand who we are and what we're working with. And then you already touched on Misty, emotional empathy, because that really removes any guesswork. It brings clarity. And again, it's in onboarding, and every quarter is assessed, is part of our eval, is part of, living in Long Beach, California is very diverse. So it's really essential for nurse directors, nurse leaders, medical health leaders to just make sure that you're not just checking off, right? Like what you mentioned, is really being there for another human being. It's liberation. It gives them a voice. It makes them feel like they matter. So that's how we approach things in our organization.
Misty?
Yeah, I really enjoy hearing what you have to say, Mirabelle. I really will take some things from you and take a look at that, because I think there's a lot of great things that you've said today already that a lot of us can probably take and utilize in our areas and organizations. We are really, I'll be honest, working on a lot of this. This is not something our hospital really probably became more diverse in the last couple of years. So our patient population has really changed. So we are learning along with our population how to handle some of this and what people need to know and how they need to learn. Our interpreters, of course, take their trainings and they do all of the things that they need to do. And we teach each other. They teach me a lot. They teach each other. We had a Nepali interpreter in-house with some Spanish interpreters, and we have an ASL interpreter on board, which is really awesome. We've learned a lot. They teach our staff as well. They do some trainings and they do help with different meetings and things that really people want to learn. Our nursing staff for the first time did grand rounds this year on interpreter services as a piece of what they learned, because we were really struggling with making sure everybody knew what to do, how to get the service, down to the basics, right? We had to go back to the basics because, let's face it, in a hospital community, people come and go. And so some of our desk folks and different people, they're moving on or they're getting another job or, life changes. And so we need to continually educate all the time. And so how do we do that? And I think, Mirabelle, you have given some great ideas for that, that we can look at incorporating here. And so, just overall, really looking at debriefing, we were just talking about that the other day. When you're in those situations, when you're talking to families about death and dying and, or you're staying there while they pass, when the family asks you to stay and, or you're seeing this magical thing happen in the operating room when this gentleman gets something, in his brain to help with his movements and Parkinson's, there's elation and there's also this, oh, I just saw a brain open. And, it's just all of those things that people need to be able to come back to and talk and just really let go. And I think a lot of times my door is open and they'll come talk to me, but what does that look like, to be with other interpreters and their other parts of staff? And right now we're separated across the organization. We're not all in the same space. So just even being in that same space to help really gain a lot of that trust with the team and, be able to talk about what does the organization need as a whole, really to look at that culturally respectful, emotional empatheticness, and just really have the tools they need to guide our patients and families and make them have a really good experience.
Wonderful. As interpreters, on the emotional part, we're not allowed to show our emotions, but of course we feel and we understand when someone is struggling. And when I've had the opportunity to train interpreters, I like that they understand how important the work that they do is, and that is enough value to what the encounter is. Understanding that you're helping in every situation that there is an interpreter, their job is to help to facilitate the communication. So that right there is a reward. And also to make sure that whatever emotion or whatever that limited English proficient person wants to communicate is important, and you have to pass it on. Interpreters are to be continuously trained. We are to continuously receive training. But for me, aside from formal training, what has worked wonders is sitting on a table with other interpreters and hearing them share their experiences. Of course, we will never share names. There are laws that prohibit, but we do share situations. And one is going to say, oh, I handled this way and I was able to assist the patient this way. Whereas another interpreter may have a different method of handling the situation, and they've all been able to resolve the lack of communication. But it culturally, it is a tree of what can happen during conversations and how we're able to facilitate this.
That is so true. And I would add, honestly, like that is really a great option, or gives your teams that are not interpreters necessarily an opportunity to kind of share what they've learned from their experience and how they can help their teams understand, this was the way that worked out for me, that worked the best for my patient, that really allowed us all to be on the same page while we were together, obviously following HIPAA requirements and things like that. But, just being able to talk about language access, to have it at the forefront of the conversation is going to it's going to put it at the front of their mind so that they're always going to be ready to, work for that patient's needs when it comes to language access. And again, going back to the checkbox, making sure it's more than just, yep, we're good to go here. We did the language survey. We know what they need. We called an interpreter. Oh, we don't know if anybody showed up, but we did what we were supposed to do. We've got that. Check.
Adding also to this, I think for interpreters, part of the culture is to make sure that before the actual communication takes place, we clarify how the communication is going to go. Okay, I will be your Spanish interpreter. Whatever you say, I will go ahead and pass it on. It will be transparent, and I will not, just doing a briefing of how the communication is going to go. And sometimes we've had to educate the clients as to how they should communicate. And Liz did mention this earlier. Whatever you're saying, I am going to speak on in first person and make sure that when your patient is speaking, I do the same. And then if someone is talking over us, we pause, we educate, and we also share part of our culture. And we do this just to make sure that whenever they encounter another interpreter, they're able to have a smooth process. We've seen a change in this, and I think this has been because now more organizations are understanding the importance of having a language access department, and so they're taking care of that training in the back end and facilitating the communication for us as well. All right, we're moving on to our last question, but before that, I want the folks on LinkedIn to share their comments, their questions, if they have any. And once we have wrapped up here, we're going to go back to you. Okay, so what's the most rewarding aspect? This is my favorite question. I would have to let you guys know. What's the most rewarding aspect of providing language access services? How does seeing a patient's journey transformed by clear communication motivate your work? Liz, and I think you had very delicate experiences being an ASL interpreter.
Yeah, I did. I did a lot of healthcare, a lot of education, a lot of everything. And when you see that person, I can't describe it. I don't know if you've seen it before, you know what I mean. When you walk in the room and you're like, oh, I'm the interpreter. And they're like, oh my gosh, I'm just so relieved that you're here. I have been waiting for you. It's like, I got you. Let's go. We're going to make this happen. Whatever it is, we're doing this. And, a lot of times, especially as from what I've seen in the deaf community, there is such a challenge to provide ASL interpreters on site for many different kinds of appointments. And it's just because there's not enough of us, right? There's just not enough. And, when you show up and this person has had their appointment rescheduled 5 times because they couldn't get an interpreter, or it's a job interview that has been postponed, that is that person's future and their livelihood. And when you show up and they're like, yes, let's go, that's what made me come back. I just kept going back and back and just being there to support that person and to present them authentically and realistically as, just like you said, everything that their emotion, if they are screaming at their doctor because they're not happy with what they just said to them, that's what I'm doing, so being able to be as clear and just, this is what you're experiencing here. This is what they're saying. And if I'm getting emotional and I'm yelling, it's because they're yelling. So, I always liked not yelling at people, obviously, but just being able to provide that authentic communication.
Thank you, Liz.
Definitely. Yeah.
Misty?
Yeah, I mean, as a manager of the services and not being out there doing the interpreting, my joy and reward comes from seeing and watching the interpreters and the interactions with the patients and families. Liz, you said exactly what I was thinking. The eyes light up, it's like that breath of fresh air. The shoulders come down.
Yeah.
They're just so thankful that somebody there can help them communicate. And I think, Catherine, you said it, in a scary situation.
Yeah.
You don't know what's going to happen, what the outcome's going to be. And now you have somebody that can help you get through the situation. I think, we see families that come back over and over again. So we have the Children's Hospital and different things. So those families, when they see our interpreters in the hallway, and maybe somebody didn't ask for an interpreter, guess what? Now they're going to get an interpreter because they know somebody, and that changes their whole stay. It makes a difference. I just think it reduces frustration. You see the change. And, on the flip side, for our providers, it makes a whole difference for them too, because now they can communicate as well. And the communication is a dyad both together, and they're coming up with a plan together. And now there's a difference with patient safety and quality. There's so many things that come out of it. So that's where, I get to see from my angle and perspective what happens. And brings me, and of course the patient experience stuff that never goes away. So, that passion is there. And for me, it's super important. So I said to somebody the other day, for me, I'll never get rid of that patient experience, patient family-centered care modality. That is always in me. That's just who I am. So you're never going to get rid of that. When you look at interpreter services, you've got me in both. So that passion will never end. And I enjoy seeing and taking that passion and throwing it out on everybody else and hoping they have a positive experience.
Wonderful.
Wow, I can sense your passion right off the screen. Really, Misty, it's palpable. And for me, it's really witnessing dignity restored, right? You're giving back their dignity, you're giving back their voice. They're reclaiming their voice. They feel like they matter. They feel like they're understood. It's a game changer for nursing. Can you imagine a nurse figuring out what's wrong with the patient? Language access has just turned things around. Now we can just bridge that gap and find the care plan and treat the patient. The patient might be saying pain, 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 but you don't get it. The patient might have a straight face, not really exhibiting signs of pain, but is in pain.
Mm-hmm.
So this has been such a huge success in the healthcare industry, giving nurses tools in order to give the best care to our patients. So this is really good. I'm really loving this conversation.
Wow. If you know our department and what we do, you would know that each of us are very passionate about what we do. And it's very rewarding every time that one of our scheduling coordinators, Liz knows this, is able to cover that one assignment that we have been struggling with for some time, because there are certain languages, but not only the languages, also client requirements that are not small. And we have to make sure that whomever we provide is able to comply. So sometimes we may have a resource, but we're not able to provide them because of the law. And so every time I see and my team sees that we're able to provide a resource for the rarest language that you can imagine, it is very satisfying. We had a case recently in which a person was in a very sensitive situation, and they were not in a very nearby area, and so it was hard to get an interpreter out there, and then also the availability of interpreter was not matching with the need. But it days went by, but we were able to provide. And for me, it was like, oh my God, they're finally going to be able to communicate But it didn't end there. When we sent that resource, it happens that that resource we sent was not the preferred non-spoken language for that patient. And so we had to continue trying to provide services until we were able to make sure that they communicated adequately. This is from the direction side, but as an interpreter, I feel every time I'm in an encounter, I feel like a superhero. I am very passionate about interpreting, and I want to make sure that with every delivery, I give my best and that the patient is able, or the doctor is able, to communicate as they deserve and as they should, and that I don't leave anything behind, because everything is important. And I have to say that whenever I was interpreting over the phone or live, and I heard that thank you, and their voice was different as to when the communication started, that was just the reward for me. So I think this is a from start to finish, and I know in your industry as well, ladies, on the medical side, it is very rewarding to see that you have resolved a problem or maybe initiated a resolution when there is one. So yeah, I think I chose the right industry to work. I'm very happy. Okay, so I don't see any questions on the screen, no comments either.
There's
I know
actually
yes, go ahead, Liz.
is one.
Oh,
It looks like it would go really well with Mirabelle.
Mm-hmm.
It's from Alex. It said, I'm sorry, Catherine. There we go. It's on the screen. Go ahead. I
Alex
saw it
is
and I was like, I
asking.
want to know too.
Oh, I don't see it. I don't see it. Okay, thank you, Liz. Do
Yeah.
you measure the long-term impact of language services on, I think my screen is, on health outcomes for limited English proficiency patients? Whoa,
It's a very
that's
good
a good
question.
KPI that he just gave
Like,
us.
I want to know too. Tell me, how does
It
that
is
work?
an outstanding. I love this question, Alex. Thanks for asking. It's all about healthcare disparities and social determinants of healthcare. And the long-term impact is number one, reducing readmissions to the hospital, right?
Mhm.
So if we keep this access, easy access of healthcare, in addition with additional language access on top of it, patients can be at home, like you mentioned, Laura. There's the telehealth services, virtual health services, where they can have all of that in the safety of their homes. You don't have to drive to a clinic or to an urgent care or to the ED. Long term is readmission rates will go down, morbidity it will definitely go down. You will see less mortality rates and all of these things, CHF, pneumonia, and all these things that we are heavily working on post COVID. We realize not only economically, patients without insurance now language can now bridge the gap and get to all these pockets of communities where we cannot access. So this is a great question. It reduces readmission rate. It brings education to the community in the comfort of their homes. It can get survey. We can get survey feedback on how we can make it better for them. Thanks for this.
Absolutely. I want to read a comment from Haido. This is going back to our previous question, I believe. He says, I agree. The real reward is being able to help people. Also, I believe that empathy is essential, but it must be complemented by ongoing professional development, just our initial training, but continuous learning, staying up to date with new terminology, and deepening our understanding of both our own culture and that one of the limited English proficient. Beautifully said.
Love that so much.
Same.
Ligia, and I know she is great at sharing her own experience. So she agrees that it is a great way to learn from our peers, and that she loves having a conversation with other people in her interpreting team. And I do too. There is never a dull moment when you bring interpreters together when it comes to our experiences. Liz, you wanted to say something else?
Yeah, I just wanted to follow up with the surveys that you're doing, Mirabelle, for the patients after they're gone, the post-procedure, post-experience surveys, and just how excellent that is, because it's something that I think, as Andrew mentioned in the comments, it's something that we're missing is getting that feedback about the, the the outcome afterwards, knowing what worked and what didn't, what was there, so that we can improve, so that you guys can improve, so that we can all ensure that that patient experience is meets expectations, surpasses expectations, and that they feel safe and comfortable. And I think that the survey is such a great way to do it.
Thanks. I love that, because it's not, we're making sure it's individualized. It's very uniquely tailored to that one individual.
I love that.
It's a one blanketed way of treating people. It's very individualized. Thanks for that.
Yeah, absolutely. That's so cool.
All right.
Mirabelle, can I ask quickly to Mirabelle?
Yeah. Sure.
With the survey, do you incorporate it into your survey that you already give? Like, we give a survey from the hospital. Are your questions separate from that or incorporated into your survey?
It's a separate targeted questionnaire.
Okay.
Because
All right.
that's the only way we
Thank
can
you.
really extrapolate that particular data.
Yeah.
Okay.
That makes sense.
Thank you.
I know that, hospitals, especially administration, they love the data. If you got the data to prove that what you're doing is working or that you need more support, that is the way to do it. Every hospital system I've talked with about this, they're like, data, data, data. You got to get it. If you want more, if you need more, you have to show. And data is beautiful. That's what we
They're
need.
the source of truth. That's the source of truth.
Yes.
That's where we're going to take and run with.
Yes, absolutely.
Yes. All right. So as we close, I want to sincerely thank our panelists for their wisdom and their lived experiences and what they've shared with us. And to all of you listening in, thank you for joining us in this very important conversation. It is very clear that language access is more than just interpreting, translations, and everything else that has been added just recently. It is also a foundation of trust, especially in the medical industry, safety, and dignity. We believe that every patient deserves to be heard. I personally believe this, understood and cared for, no matter what language they speak. We hope you leave today inspired with practical tools and a renewed commitment. I know that Misty has great ideas today that she's going to bring onto her team. And we want to make sure that equity is not only as other people see it, but also that we include communication in there. Thank you again for being here. Liz, thank you so much. Always. Misty, Mirabelle, it's so nice to meet you. And I look forward to seeing you in other roundtables that we have.
It was
Thank
great
you.
talking with you guys.
Everyone.
Thank you.
Thanks so much.
Great.